Hello, it's Tessa, one of the news editors at Manx Radio, and today we're talking doctors and what doctors think about working for Manx Care. If you take the results of a new NHS survey into the culture within the health body at face value, it would appear not a lot. The Culture of Care Barometer invited 161 doctors who work for Manx Care to respond to questions on things like engagement, empowerment, management, leadership and resource. 72 doctors responded, marking a response rate of 43%. That survey was conducted between the 19th of May and the 8th of June. It's the second of its kind, with the first sent to doctors in 2022. Now, the British Medical Association, and I pause here because I'm sure you'll be familiar with this professional association and trade union. It's the one heavily involved in supporting Dr. Rosalind Ranson in her employment tribunal. Well, it's reacted to the survey's findings. It says it shows issues with engagement, poor morale and a lack of confidence in hospital management. I sat down with Professor Philip Banfield, the Chair of Council for the BMA, to find out more.
3 out of 4 felt that the culture within the organisation wasn't positive at all. 3/4 felt not listened to, and 2/3 felt that they didn't really know what was going on within the organisation. And that also then translates into a sense that they don't feel that there is strong leadership, and we have to explore the possibility that that is true. And so I'm going to meet with the doctors of the island again tonight to explore how true that may or may not be.
And obviously the questions that they have been asked are set questions. They were asked the same questions in a survey that I believe took place last year. So you've got a comparison now between how things stood in 2022 and how things stand in 2023. How useful is that?
Well, the comparison as such has limited use. The issue for Manx Care at the moment is because of the concerns that have been raised previously in relation to the case of Dr. Rosalind Ranson. There was a temptation to say that these were isolated issues and that there wasn't a problem with culture on the island. That isn't what I found when I came across. So this gives us some objective evidence. And if you're an organisation that has reports of people feeling that they can't raise concerns, you should want to know more about it. So I would say that the emphasis now is on Manx Care to prove that these results aren't true, and if they are true, they need to set about engaging their professionals in a more productive manner, because that affects patient safety.
Do you think there is an acknowledgement in Manx Care that there is a problem with culture?
Well, I'm not sure about Manx Care at the moment. I did meet with Laurie Hooper today, and we did talk about the survey. He hadn't seen the survey in any detail, and we discussed that it's the underlying possibility that this may be the situation. And he's offered to look quite positively at the possibility that there are concerns about culture that need to be addressed, and therefore I felt we were making progress with a possible acknowledgement, and that's what we will build on from here.
I mean, the Health and Social Care Minister said also to us that he hadn't seen this survey. We know that Manx Care had seen it. We know that they'd prepared a response to go out in line with when the embargo lifted today. I mean, is it a concern that the Health and Social Care Minister, the man at the very top of this tree, isn't aware that that is going on behind the scenes?
Well, I don't quite mind when the Minister actually makes the acknowledgement, as long as we make progress and do something about it. And this is the important bit. It's the what's happens next, because you do have an opportunity to improve engagement. It's medical engagement that is associated with how well your organisation is working. It doesn't feel, from the feedback that we've been having from BMA members on the island that the organisation is working well, and therefore we are here to support doctors on the island to make it a better place to work.
And you mentioned that you've had a meeting with him. He's been critical of the BMA previously, saying that claims that have been made by the organisation haven't been supported by the evidence. Did he raise any such concerns today?
Well, I would expect that pushback from a politician. In some ways, there are two separate issues. One is how Dr. Rosalind Ranson was harried out and victimised out of her post and treated appallingly. And because that is a live legal case, we agreed not to discuss that today. So those consequences for the tin wall must be played through in the future. So we concentrated on the possibility that there is a cultural deficit within both the Department of Health and Social Care and Manx Care that needs to be addressed, and he acknowledged that if that was found to be the case, and that he has offered to listen to more evidence, if that's found to be the case, then they will set about working with the doctors and the BMA to put things right.
One of the issues that this survey highlighted was around senior leadership. So 66% of doctors who responded said they disagreed or strongly disagreed with the statement that they felt well informed about what was happening. 3% agreed that there was strong leadership at the highest level, 79% disagreeing that there was strong leadership. Do you think the Chief Executive and other members of the senior leadership team should retain their positions?
Well, that's not for me to decide. That's for the professional staff of the hospital to decide whether they still have confidence or not in the senior leadership team. I will be discussing this with the doctors tonight. I'm specifically asking them to highlight whether we are wrong and we've missed the point. But actually, I don't believe that that's the case. And we've had a lot of contact since my last visit suggesting that there is an inherent issue at the top of Manx Care needs to be resolved. Unless there's a change of approach and attitude, it is difficult to see how that management can stay in place.
Something that probably goes hand in hand with that is that 60% of respondents said they didn't feel that unacceptable behaviour is consistently tackled. Teresa Cope has told us today that she believes some of the issues that have been highlighted as a result of this survey are actually due to a lack of respect between doctors themselves and not doctors versus the management. Do you have any evidence which would suggest that she was correct in that point?
I think in any organisation that has a relative few number of staff, there will always be conflicts at whatever level you're operating in. The difficulty with the data that's shown in this survey is that we're talking about large numbers of people, and you do not have this kind of quantity of people falling out with each other. So it suggests that there is something systemic that needs to be approached and looked at. Actually disagreeing with people should be welcomed. It's what you do with that and how you work out differences that make a productive health service, especially if you are trying to develop a health service to be world leading, to develop a health service that attracts people to the island. This should be an incredibly attractive place to come to work, and it's such a shame that it's getting the press that it is at the moment.
The statistics show 48% of the doctors surveyed are not proud to work for Manx Care. 65% don't believe that Manx Care values the service that the doctors provide or that it's a good place to work. Simple question, why would anybody want to work for Manx Care?
Well, you're going to have to ask Manx Care for that, and it's for them to work that one through. We will help the island get back on its feet, and we will help the doctors to make it a better place to work.
So let's talk about how we change culture then. Do you feel that Manx Care has a plan to tackle some of the issues that have come up, or is it all words?
Well, you need actions instead of words. The words are there. the feedback that we're having is that the actions are not backing those words up. So we want to see compassionate leadership that listens and respects the staff, that doesn't try and impose management diktats on them doing the job. A number of doctors, for example, have fed back to us saying they're not able to do the job that they're employed to do. They don't have access to theatres, for example. A company is brought from Scotland to use the operating theatres instead of the Manx Care medics themselves, and that leads to a lot of discontent and makes it not such an attractive place to come to work. So you do need to have an environment in which the whole culture from the top is lived rather than just talked through with one rule for one and a different rule for someone else.
And just my final question, Theresa Cope has told Manx Radio today that people who aren't having a good experience at work do have the confidence to speak to Manx Care directly about their concerns. She's also mentioned a people, culture and engagement strategy that they're working on. Has the BMA had any input into that strategy? If not, will it? And do you believe that could be the fix for the issues being experienced?
It's very much for the BMA to get involved, and the local negotiating committee is very much part of that. It's not about writing a document. It's not about having a plan. It's actually delivering the lived experience. It's a challenge not only for the Isle of Man, it's a challenge for many healthcare systems and trusts across the UK, which is why the BMA is looking at more than one trust across the UK at the minute, because we do need to change the way that doctors are engaged. We know that it's the level of medical engagement that determines the success of an organisation, and if there's any chance that the engagement could be better, you need to do that because the patients deserve better care.
You heard me mention the Health and Social Care Minister, Laurie Hooper, there. He's since issued a statement in his role as Health and Social Care Minister, saying, and I quote, "I am unable to provide a comment on the BMA survey results at this time. I'm going to pause again there because the BMA is at pains to point out that the survey was not put out by it. It is an NHS survey and it simply reported the findings." Let's go back to Minister Hooper's statement then, and we'll start again. So he says, "I am unable to provide a comment on the BMA survey results at this time, as the report was not shared with the Department of Health and Social Care ahead of publication. Once the department has had time to properly review the document," he says, "we will respond appropriately. I can confirm we have met with the BMA today." That's Monday, the 19th of June. "We had a positive discussion focused on how we work together to move forward." And as for Manx Care, well, it did have the survey results shared with them and it did produce a response. It says developing a healthy culture will always be a work in progress, and it's working on a people, culture and engagement strategy. We've dedicated a whole episode of newscast to Manx Care's response, in which you can hear from the Chief Executive, Theresa Cope, in full. You can find the full Culture of Care Barometer results by visiting manxradio.com.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.